Hello and welcome back to Aging Well, a monthly production of Somerville Cambridge Elder Services. I'm Nathan Lamb, your host, and with me today are social workers Lisa Waxman.
Hello.
And Carolynn Nagao-Marcotte.
Thanks for having me.
Thanks for joining me. This is great. Today we're discussing the Community Living Options program at Somerville Cambridge Elder Services. This is a private pay program that provides a wide menu of services that are tailored to meet an individual's needs. And there's a lot of things this program does, and it's not easy to explain in 25 words or less. But if we were going to try to do that, we've got the two people who could do it right here in the studio, so I'm very excited. Now, we discussed the wide range of scenarios in which you guys can help in the first segment, and we have really stringent privacy requirements, so we can't actually mention specifics that would identify anyone, but we can talk in general about some of the scenarios that you guys deal with in working with the program. And I'd very much be interested in hearing a little bit about how things can go.
Sure. So I think one thing that we help a lot with is transitions, whether that's a move to an assisted living facility or a nursing home, or maybe staying at home, which a lot of people do want to do, and just bringing in different services so that that can actually be possible for the person. Oftentimes the family notices that things really aren't working out anymore, but they're not really sure why. So we're able to kind of go in and figure out what it is the person needs and how we can keep them at home if that's what they want, or how we can walk them through the whole process of relocating, from doing the research about the facilities to touring the facilities, the application process, going through the insurance, all of that we can help with. So one example that comes to mind is a client I have whose family felt that she couldn't stay home anymore, that she wasn't safe, and that she should be moving in with one of her daughters or an assisted living facility, which she did not want to do. She really had a high level of need, so we had to bring in a lot of services for her, but we were able to make that happen. So some of those services were some home care services, so having private aides, arranging for her to have transportation, and because her family lived out of state, she needed a lot of help with the medical advocacy stuff, which is really a higher level of case management that you could get with any other program. But I was able to go to her doctor's appointments with her and really stay informed about what was going on and help her be medication compliant and with all the follow-up and go through that whole process so that the family didn't have to worry about it. So having those services in place has allowed her to stay at home, which is what she wants, but also giving her family the peace of mind that that she's going to be safe at home.
Mm-hmm. Sounds like a real win-win.
Mm-hmm. Yeah.
And from your end, can you tell me a little bit about some of how it goes? Is it usually a straightforward process, or is there a lot of twists and turns that you have when you're going through?
Yeah, there are a lot of twists and turns. Like Carolyn said, a lot of times we have to go through the motions with an older adult and their family if they're thinking about another placement, assisted living, or a nursing home. Somebody needs to coordinate all that, especially if there's a home to sell and there's moving that needs to happen. So it's researching movers, mm-hmm. And looking at different facilities, making sure that it's going to be a right fit for a person. If an individual decides that he or she isn't ready to go, that's fine. We work with them on staying in their homes. Mm-hmm. But oftentimes what we see with our folks is they just can't keep up with the things, the day-to-day things that would help them stay at home. Carolyn mentioned medication compliance. Sometimes our clients need us to call and remind them to take their medications, mm-hmm. and that's part of the care plan. I have a client who I call regularly to remind her to take her medications, and she's happy for the phone call. It's a daily check-in. Other clients can't remember to refill their medications, so we keep track of what needs to be refilled, when it needs to be refilled. If it's a pharmacy that doesn't deliver, we can go and pick up the medication. And then we can also go to the doctor's appointments and help the medical provider be more aware of how it's going in the home. I had a client who was having trouble using eardrops that she was prescribed because she had a lot of arthritis. So when we went to go see the doctor, she told the doctor she'd been taking the eardrops, and I knew that she wasn't. So I had explained to the doctor that she was having a difficult time putting the eardrops in your ears because of her fingers not being so nimble. And this was information the doctor needed to find a different type of bottle for her that would be easier to use, which he was able to do. And now she has a pretty simple bottle that basically the drops fall right out into her ear.
A small thing that can be a big deal.
Can be a big deal, yeah, because she had quite a bit of buildup in her ear that needed to be attended to. There's just a lot for people to keep track of. Pets, you know, I've had a client who had a pet who the pet needed to go to the vet, and if there's anything wrong with the pet, there's often follow-up that's needed, and many times we just need to keep the treatment schedule up for the pet. So it's a matter of getting in help with somebody who can help take care of the pet, or bring the pet to the vet on behalf of the elder if they can't get there themselves. We've also worked with people who unfortunately did decide that they, well, fortunately, whatever their feeling was, that they wanted to move on and go into a nursing home. And we've been involved in having their apartments sold and their items distributed. We've helped with that, moving out of their homes into their new locations. And we will stay involved with somebody if they move to a nursing home or an assisted living, and oftentimes our work is different because now we are being their advocate in the facility if the family member can't get there as often as they'd like, make sure that their care is provided in an appropriate way. We attend care plan meetings. I have a client who I shop for. She's in a nursing home and she often needs new toiletries. She likes to have new clothes seasonally, so she always has a list for me, so I go out and do her shopping for her. And really whatever the elder wants that we can, is feasible for us to do, we're happy to do it.
That's great. Now you kind of alluded to options and planning for the future. Is helping people do advanced planning also one of the services that you provide?
Yes, one of the first things that we do with families is we ask if there are advance directives in place. We want to know if there is a durable power of attorney, if there's a healthcare proxy, what the elder's wishes are. God forbid they need to be resuscitated, if they want a do not resuscitate or a MOLST document. So oftentimes we'll talk to family members and they'll say that they really haven't had the opportunity or don't know how to bring up the subject, even around funeral planning, and just kind of those very necessary conversations that have to happen with older adults, especially if their health is declining. So that's one of the ways that we get involved, especially since we are so intensively involved and it becomes a very close relationship. Both family members and the older adult like that we're involved. We are kind of that middle person who can lead those discussions and ease the decision making between parents and their children.
So on one hand, it's making sure the advanced plan is in place, but also facilitating the discussion, which might not always be easy.
Yes, exactly.
So that is very important. One other thing that I see in all the marketing materials for this is that there's 24/7 support. Can you tell me a little bit about that?
So we have an on-call line that's available 24/7 where the individual or their family could call in with whatever issues may arise, whatever concerns they have, and they'll be able to actually speak to a clinician to address those issues.
That's great. So basically whenever they need a hand, CLO is available for them there.
Yeah, and in a situation where that might occur is, God forbid, an older adult falls, and it's the middle of the night or early in the morning or on the weekend, and they're taken to the hospital. If their family member is out of town, we are obviously closer, so we can be called to get to the hospital, get to the emergency room, be with the older adult, and help reassure them and be involved in the initial care planning that's involved in the hospital.
Now you've mentioned a couple times communicating with the family. How does that, in general, how does that arrangement go between communicating with the person receiving care, and then the family. I suppose that's probably all hashed out up front for how much communication back and forth, because the children might want to hear fairly regularly how their parent is going. So is that something that's just sort of figured out at the beginning?
Yes, it really depends on what the family wants and what the elder wants. Some people would just want a weekly update of anything, or if there's been any changes. Some people want a phone call. Some family members just want a quick text, especially if it's somebody who can't visit as much for whatever reason. They don't have to be living out of town. They may have a very demanding work schedule or family concerns of their own, with their children. Sometimes they just want a real quick word. I visited mom, I visited dad, things are looking great. It's very reassuring to know that somebody with an objective viewpoint is visiting. So, and sometimes family members want to get involved in a particular task themselves, and that's certainly up to them. And we will support them in that work if they want our help, and or we can take over at any point that they feel like they can't continue. So it's kind of an evolving thing. I know when family members go on vacation, especially if they go out of vacation out of the country, they are so happy that we're around and that we have 24-hour availability, because they feel reassured that if there's not a neighbor nearby or another relative, that somebody is around who can kind of be there to, if God forbid anything happens.
Yeah, we're very flexible about that. So some clients I have, they really want me to be their partner in navigating the whole elder care system, and they want to be very involved in every decision made. And they just want that expertise of having a clinical social worker by their side. So we're happy to do that. I also have clients who have distant family members who live out of state, and they maybe don't have anyone, any children or spouses or anyone who's able to be super involved. And then they really just want to, need to know basis, and are very grateful that we're able to take over the care and make sure that nothing has to go to them that they're not prepared to handle.
That's great. And you mentioned connection with Elder Services, and maybe that's a good time to discuss service area.
Yeah.
We are Somerville Cambridge Elder Services. That's the organization. But Community Living Options has a slightly different, slightly larger service area.
Yep. We do have a number of clients in Somerville and Cambridge. We do service the Metro Boston area. One of the things that I think it's important for people to know is if it's a client who lives in Somerville and Cambridge, we will offer and they need in-home care, we will offer them state subsidized services that they're eligible for. That's another way that we're a little bit different maybe than other geriatric care managers. By knowing a person's financial eligibility, we know what they're eligible for. If somebody's eligible for Mass Health, that's something that we want to make sure that they apply for. If somebody's eligible for our state subsidized services, we want to make sure that they get those services first. Before they pay privately for any care, we can use the resources we have within our agency to make sure that they're getting whatever they can, whatever they're eligible for free first. And then the folks who live outside of our agency area, outside of Somerville and Cambridge, we also work with other home care agencies, Mystic Valley Elder Services, North Shore Elder Services, and the like, to hook them up with those agencies while we work with them.
It's an important detail, absolutely. And I think the other one was, I had one more and I completely forgot. How embarrassing. Anything else you'd like to add?
I think that's it.
All right, well, that's it for this segment. We'll come back in a moment and wrap things up.